doctor, I feel bad.
What's wrong?
I had a little cough and I think I have temperature.
I'm going to check your temperature. Please lay down. He has 102.2 degrees temperature.
How much is the normal temperature?
98.6 degrees. Have you been out to parties or meetings lately?
Yes, of course. Every weekend we meet at my house.
Has any of the people had COVID or the flu?
Yes, my coworker had a cough, but she said it was COVID, even though we don't to believe that is a pure invention for the government.
Is it responsible for people to keep dating? I don't understand as there are still people to ignore it. That's why they arrive almost cooking.
Oh, no one. I knew was sick that we didn't pay attention to news.
Well, you need to take the COVID test laboratory.
Very good. Thanks, doctor.
I will see you in 3 days with the results and keep the mask on.
3 days later.
Doctor, I feel much worse.
Let me see, do you have the results?
Of course, here they are.
This positive for COVID. I will do some checkups. Lie down.
1 eternity later.
It has been a few days. How have you felt with the treatment?
Much better. I have almost no cough and I think there is no temperature.
Well, let's check you. I check your throat and temperature. Lay down.
Of course, doctor.
It has continued very well. I noticed that your throat is no longer so swollen and does not have a temperature. Yet other studies have to be done to check if you still have COVID.
Thank you very much, doctor. Now I understand the importance of taking care of ourselves before this pandemic.
Then you will have to do the laboratory test again.
Yes, doctor.
See you in 3 days.
Much later.
Doctor, the results are ready.
Let me see you. I hope it's good news.
I hope I really want to see my children and my family.
Indeed, the results are negative.
What great happiness!
We have a testimonial program from recovered patients from COVID. You could participate by telling us your experience if it is agreed.
Of course, I would like to help all the people who like me too. That this was again, this pandemic almost ended my life.
You are discharged from this hospital. Your family is waiting for you.
Thank you very much, doctor. I want to see you.
Don't forget to keep taking these prevention measures.
Of course not, doctor. I would not like to go back.
Final project of coronavirus. Coronavirus is a family of viruses that cause disease in both animals as well as humans. Cause respiratory infections ranging from a common cold to serious illnesses like the syndrome of the Middle East, MERS, and severe acute syndrome, SARS. COVID-19 is an infectious disease caused by the coronavirus that has been discovered more recently. But the new viruses like disease were unknown before. The outbreak will erupt in Wuhan in December 2019. Symptoms. The most common symptoms are fever, dry cough, tiredness. Less frequent symptoms: headache, nasal congestion, conjunctivitis, sore throat, diarrhea, loss of taste or smell, rashes cutaneous. Most people recover from the disease without the need for hospital treatment. Other people and those with medical conditions previous such as high blood pressure, heart problems or lung cancer, diabetes, or cancer are more likely to present serious pictures. When is care needed? Immediate medical. People of any age need immediate medical attention when they present fever, cough, shortness of breath, chest pain or tightness, having difficulty to speak or move. How does it spread? A person can contract COVID-19 from being in contact with another that is infected. The disease spread mainly from person to person through the droplets that are thrown from nose or mouth when coughing, sneezing, or talking. These droplets are heavy, do not go very far, and fall quickly to the ground. That is why it is important to keep a place a meter away. They can also fall on objects and surfaces that surround the person such as tables, nose, and railings, so that other people can become infected if they touch these objects or surfaces and then touch your eyes, nose, or mouth.
For the population, wash your hands frequently with soap and water or use solution based on 70% alcohol gel. When coating or essence, use the label scenes, which consist of covering the nose and mouth with a tissue or the inner corner of the arm. Not split. If necessary, use a disposable tissue put in a plastic bag, it up and throw it away. Then wash your hands. Do not touch your face with a dirty hands, especially your nose, mouth, and eyes. Clean and disinfect surface and objects of common use in home, office, places, clothes, transport, meeting place, ventilate, and allow the entry of sunlight. Stay home when you have respiratory illnesses and go to the doctor if any of the symptoms occur. Avoid as much as possible contact with people who have respiratory disease. For medical personnel, wash your hands with soap and water or using alcohol solution, disinfectant before and after caring for a patient. Dry your hands with disposable towels or dry them in position vertical. Avoid touching your eyes and nose and mouth as much as possible and wash your hands afterwards if or having done it. Use a mask only if your care for patients with respiratory infection covering mouth and nose completely. If possible, wear glass to protect eyes. Throw in the container of bioinfection hazardous water RPVI all the disposable material that I use with each patient. Sterilize all medical instruments, keep all work areas clean, report if they present respiratory symptoms to be evaluated and avoid intra-hospital transmission. Be vaccinated against influenza. Treatment. There is no medicine that cures coronavirus, only to alleviate the symptoms that they generate. The virus that causes COVID-19 is very new and there is no vaccine. In almost cases, the disease is not serious and is controlled by the body about 2 weeks.
If you have symptoms compatible with COVID-19 and you have difficulty breathing or belongs to one of the risk groups, then cover your mouth and nose with a mask, a scarf or kerchief, and go immediately to the doctor or clinic more close.
If you don't have symptoms, stay home. And remember, you should not self-medicate. The rate of confirmed cases of COVID-19 per 100,000 inhabitants in Mexico was 179.16. Until June 30, which is why in this item it was ranked 61 overall. Today, 174,538 people in Mexico have recovered from the disease.